most of the things I do with relation to the lower lid, I try to avoid scarring. So if there's an alternative for me that does not leave the patient with an external scar, that's the one I'm going to go to. So when I perform a transconjunctival fat approach, I'm going to actually pull that lower lid down, expose the fat from the inside, and then remove it or reposition it depending on what the patient's appearance is. So if they have a deep crease here, I'm going to take that fat and I'm going to not remove it, but I'm going to tunnel it and fill that crease. So the question patients ask is, well, what's the crease? Well, the crease is, if you think of it, this is a mountain, and we have a valley. And so if you want to look younger, all we have to do is soften the valley, right? Let's turn the shadow of that valley into more of a highlight. And then that shadow gets better, you look better. If you think that the fat is right on the bony part of the rim, which you can feel, then if you just pull that lid down and push till you feel where that rim is, an incision right there exposes the fat nicely. There's very little swelling, very little bruising. And for a lot of patients, it's a quick return back to being who they were, whether it's work or social activities. So it's quick. The second thing I showed was called what I call an orbicularis sling. And the muscle that encircles the eyeball is called the orbicularis muscle. It has 3 different divisions of it, but the one we're worried about is that one that forms the ring around the eye. If you look at a youthful eye, so yourself included, look at a youthful eye, and you'll always see that the eye is the inside corner or the medial canthus, and the outside corner, which is the lateral canthus, should be either horizontally straight, or the outside corner should be slightly higher than the inside corner, so it kind of slants up. If it doesn't, all you have to do, in today's times is look at emojis on your phone for sadness, and the eyes slant this way. Or we want them to slant. If you look at the happy face, they slant up. So we want to add that little bit of tilt. Of course, we have to go through the disclaimer that you're not going to look like Kenny Rogers, bless his heart, that had it so overdone, but he had it done for a medical reason, so totally different. But you want that outside corner to be slightly higher than the inside corner or horizontal. And we can actually tack the lower lid up to the bone by tunneling it under the skin. And it takes 10 minutes to do, but it's so subtle, but yet so precise in how it comes out. And just lifting that lid, what it does for a lot of people is, if you notice, they'll get a little of the white under the iris or the colored part of the eye. And that's called scleral show. Kind of, if you think about it, kind of looks like the Hush Puppy dog ad, where the dog has the white under their eyes. Well, if you just tack it up with a suture that's totally under the skin, it's a nice, softer, it opens that eye in a really pretty angle. It's much more aesthetically pleasing to have an eye that's up. And if you look at covers of magazine models, they all have this slightly slant to the eyes going up. So it helps out in that regard.